Today is Tuesday, November 10, 2020, and we are going to be covering Module 1A on Semen Analysis. My name is Ashok Agarwal. I am the host of this program for the next 2 hours. So welcome to all of you, and we are ready to begin now. I want to declare that we don't have any conflict of interest. As you can see, the program was completely organized by the support from our center, and no companies or outside entities were contacted for any kind of sponsorship. Webcasting was supported by our Cleveland Clinic IT division, David Reichling and David Wolfley. Course faculty have donated their time for this online training. Program coordinators, and we have 7 of them who have volunteered their time for this training. And more importantly, the names, images, and description of certain products or instruments which you will see during the lectures are being used routinely in our andrology lab, and we are not endorsing any of these as speakers. So today's program is going to be including Module 1A, which is Manual Semen Analysis, which you have seen in the announcements that we have provided you. I am in charge of the andrology program at Cleveland Clinic, and I'm also the director of the American Center for Reproductive Medicine. I wear a couple of different hats. I am very much involved in managing the diagnostic lab of the Cleveland Clinic, as well as our program in male infertility research in Cleveland Clinic. We are recognized as the #1 program in the world in the fields of male infertility, andrology, and human-assisted reproduction. And this is based on the number of peer-reviewed publications, based on the number of citation scores that we have, and also based on the H-index. And these are the numbers that anybody can check anywhere in the world. If you go into Scopus database that rates every single researcher or author in the world. We have a large number of medical textbooks that we have written. More importantly, our program has trained over 1,000 scientists, clinicians, undergraduate students from United States and from all over the world. So I'm very fortunate to be running this program along with the very talented team of people who you will meet some of them today. I spent about 10 years at Harvard Medical School, where I was the director of male infertility research in urology at Brigham and Women's, and also an assistant professor at Harvard Medical School. So now let's talk about the program. That is enough of my introduction. So I'm going to skip the introductory slide and jump directly into my talk on automated semen analysis. So we go directly to what we do here. Just in terms of the basic concept, a routine semen analysis is something that you have seen. It includes the macroscopic evaluation as well as a microscopic evaluation. You also heard from Dr. Sharma that this is the first test that is considered as the most essential by the physician when they are evaluating the patient for their male infertility. And you heard from Dr. Gupta how the semen analysis should be conducted using very strict quality control procedures, which is essentially a foundation for getting accurate and reproducible results. So what else we know? Semen analysis really is an important test, but Is it simple? Not at all. It is a very complex test. It seems simple from the slides and the description that we provided, but to conduct it is extremely difficult. And why I'm saying it, because in this country, this test is actually classified as a high complexity test by the government, by Clinical Laboratory Improvement Act of the Congress. And it really it is regulated. All the andrology labs are regulated by the government, and they must perform quality control, quality assurance, and proficiency testing. The last two aspects are going to be discussed by Dr. Gupta again after my presentation. So let's see why is it so difficult to conduct. The most difficult part of doing a semen analysis is really because it is a subjective test. We are really looking under the microscope, trying to see the sperm which are moving around, zigzagging all over the field, and trying to count them while you are looking, and you don't know whether you counted them correctly. And then there are all kinds of abnormalities in terms of the shape that you're trying to evaluate as part of the morphology, which again is very difficult. But the difficulty of semen analysis are compounded because also of the biological variability that is there in the production of spermatozoa by the testis. The testis, when it is producing through the seminiferous tubule, the number of sperm cells that are released are not fixed. Sometimes they are low, sometimes they are a little bit high, sometimes they are very high. So if you recall the article in WHO, it shows the range from the same sample, from same individual collected over a course of 12 months. It can be as low as 15 or 20 million, going all the way up to 200 million. And that is considered completely normal. And that is why it is prescribed. It is considered very, very important that to evaluate a man for their infertility, the 2 semen samples should be done, 2 semen analysis over a course of 2 to 3 months, at least 3 months apart. That only can provide the actual results which you can average to say that the person is normal or abnormal. And then there are various conditions with the methodology, the use of counting chamber, the sampling error, training experience, and trying to find the results. If you are doing it by the same person, on the same sample, we have found that it's very, very difficult to get the results which are reproducible. And let alone when you have multiple individuals working in a laboratory in a busy place, trying to conduct the testing, but to try to compare and see if the results are matching is a nightmare. So the more problems are there in terms of the results, then there are more errors in clinical decision making. Many times, if the results incorrectly show that the semen sample has poor semen characteristics rather than a normal characteristic incorrectly, then the patient may be subjected to more invasive, more advanced ART procedures than trying to just go for an IUI. This is just one of many possibilities which can occur as a result of inaccurate semen analysis. Or if you have a varicocelectomy being performed, and after the surgery, when you're looking at the results of the semen analysis with inaccurate results, it may show that the results did not change, or the person did not improve in terms of the count, motility, and other characteristic, and that may force the patient to go for ART rather than try natural conception. So looking at all these conditions, we probably will not be surprised, because the semen analysis includes a large number of steps, as you can see here, doing all kinds of physical checks, then doing the actual microscopic checks. There are almost 9 steps, and even in the best hands, it can take as much as 15 to 20 minutes. Persons who have been working in this and have a great deal of experience will not be able to do it faster than that, because it will make a lot of mistakes. And then semen analysis is not complete. You have a morphology, which is the actual and essential part of a semen analysis evaluation. Using the fastest staining technique called DiffQuick, you can see there are a number of steps from smear all the way to staining and then scoring of the slides. And it's almost 12 steps, which can take as much as an hour to your time to conduct the semen analysis. So this is a lot of time. And it's just a rule of thumb. More steps that are there are more possibilities of making a mistake. So to really circumvent these problems, which we know are present all over, there are a number of devices that have been developed by the industry over the last 40 years, and these are called computer-assisted semen analyzers. These are some of the various models that are available in the marketplace, and you can see, and some of you probably have seen these or maybe using these devices in your clinics or in your labs. These are the devices. All three devices are actually being used in our andrology labs. We have almost 6 or 7 such devices which we use day to day. So the factors that really impact these devices, called computer-assisted semen analyzers, are a variety of factors that can influence the sample preparation, whether a sample is well prepared or well mixed, frame rate, how many frames you are really taking when you are evaluating the sample for analysis, depth and type of sperm counting chamber that can result in mistakes or errors. Then the devices, CASA devices or computerized analyzers, are traditionally inaccurate when the samples have high concentration, above 80 or 100 million, or low concentration below 10 or 15 million. So in general, all of these CASA devices have a really a big problem in terms of high or low concentration, and that affects the results of count, motility, and all the motion kinetic parameters such as velocity, linearity, etc. And then sperm agglutination can also interfere with the concentration, and same thing goes with the cellular debris. So these are some of the problems that are there. In terms of the advantages, of course, there are advantages, and that's why the laboratories really use. It's really a perfect system for busy laboratories where you want to improve the efficiency, you want to increase the workload, and you want the laboratory can conduct the test in a reliable, reproducible manner. And these systems use special software to extract the desired information and produce the desired output. If appropriate protocols are followed, they can provide high precision and give quantitative data on sperm kinetics, which are the major advantages of these machines over manual semen analysis. So these are not, they definitely reduce the inter and intra-operator or within the technician or between the technician variability that we see is really a big problem with manual semen analysis can be circumvented with this device. And however, the devices are not automated. They are actually good in some sense, but they do have a large number of limitations. And the limitations are, they are really huge, they are bulky, they require a lot of training. So you cannot just walk from the park and say, well, I can do this analysis by sitting on this, and just it's really complicated. It requires a lot of training, understanding the protocol, understanding the settings, and doing it several times. So it is a complex process. And then there are variations in interoperator results, and requires quite a bit of time to complete the analysis. The most important limitations of these systems are they are very expensive. So it is really out of the reach of most of the laboratories, which are looking for inexpensive, accurate systems that they can incorporate in their clinics and in their laboratory to get correct results. So we are hearing, and you probably have heard, the artificial intelligence. It is really entering in every facet of our life. The technology is really racing, and it has really entered the human-assisted reproduction. There are so many AI-based or artificial intelligence-based technologies and algorithm in IVF which are already being used. There are companies like Genia, which makes Gary a time-lapse-based device, which uses the morphokinetic analysis, uses the algorithm to assign a score to each embryo. Then Vitreous Health has EV to identify the embryo with the best chance of achieving a successful pregnancy. and it's trained on time-lapse videos of thousands of embryos during their development. Then there are devices called Life Whisperer. It identifies morphological features that constitute a healthy embryo, trained on over 20,000 globally sourced 2D embryo images. Then there is PGTA, where AI applies to PGTA in the form of a machine learning approach for interpretation and reporting of next generation sequencing results to eliminate operator subjectivity. So you can see the advance of technology is really happening right in front of our eyes, and not in terms of very advanced things like cell phone and so forth, but in human assisted reproduction where we all work. And really, I think the purpose is to really make the clinical decision system very, very predictive, make it cost effective, and we can overall improve the rate of outcome and improve the outcome of ART. So taking these things in account, the andrology area is still slow to really gain a large number of such type of devices, although we know semen analysis is where I think we require the greatest support. And I wanted to discuss about a new device called Lenso Pro Semen Analyzer, which works on artificial intelligence optical microscopic based technology. This is one of the device that have come out into the andrology. At least to my knowledge, we haven't seen any other such device which is developed and available. Maybe they are in development, but they have not been introduced commercially into the marketplace for diagnostic systems. And this uses, it evaluates the semen based on WHO 5th edition, uses machine learning algorithm to avoid subjectivity to evaluate semen parameter, which is really what we are looking at. And on the right side is the report that it generates, and we are going to talk about that in a second too. So this is the system here. The device is really fully automated, which is what we all have been waiting. It involves just 3 steps. The entire analysis takes from A to Z 2 to 5 minutes. You get the pH, you get the concentration, the motility and morphology, and the measurement range of each parameter is really maximum according to WHO. pH from 6 to 8, concentration from 100,000 is pumped to 300 million per ml. Progressive motility, non-progressive from less than 1% to 100%, and morphology from less than 1 to 100%. So if you look on the bottom of the screen, the sample is basically 2 drops of the sample, one for the pH and one for all the sperm concentration, each of 40 microliter in volume, is inserted in the cassette. And the cassette is then loaded onto the device, which is really small. It's just bigger than maybe your cell phone. And within 3 to 4 minutes or 2 to 3 minutes, it provides the results. And it provides all the values that you're looking. And to make it easy, I have a small video of 30 seconds where you can see So it really is very quick in terms of its analysis. In terms of the quality control of all CASA systems, we need to do a daily precision, which is a daily quality control. It involves both low and high concentration of AccuBead to generate the Levy-Jennings chart, as you saw Dr. Gupta explain, and the result should be within the range specified for low and high AccuBead. If results are not within this range, defined percentage difference, the manual count or motility should be used, and you will need to recalibrate the CASA if problem persists. And we have conducted a study looking at the results of, we have conducted clinical trial using the Lenso device, which I showed in the previous slide, and published in a peer-reviewed journal of our experience. And the results show very good correlation in terms of sperm count, sperm motility, progressive motility between the manual semen analysis and the results of Lenso, as well as the results between the Lenso and another CASA machine, such as the one from Hamilton Thorne called IVOS. So all in all, the results show very high degree of correlation, very tight CV or very good CV between the inter-observer and intra-observer results. However, there are some limitations of the system at this time. The sperm morphology results that we generate from this really don't correlate very well with manual semen analysis. The correlation is not very good. It cannot examine, the reason is that the machine cannot examine multiple fields, although it checks 100 grids. And also it cannot examine acrosome region, although it can evaluate the shape from head to tail. However, the company is developing new algorithm, which in time will be able to examine morphology using stained slides in your model. So in terms of the advantages of this device, these are some of the advantages. It's very simple. I'm talking about Lenso. No training required. Anybody can use it without any kind of training. It's very, very small device. It takes only a few minutes to conduct. It's very accurate in terms of a range of concentration from 0.1 to 300. pH is provided along with the semen analysis. Morphology does not require any fixation or staining, although the morphology results are not very highly reliable at this time, but the accuracy of the results will change. A very good correlation between inter and intra-observer. And the most important part to me and for many others who are using this device is that the results are available within few minutes. While the patient is waiting in the lab, while you are having the patient collect and provide the sample, the results are ready, and you can have these results given to the clinician, and they can discuss the results rather than asking that I will call you or the patient has to call back after 2 days or 3 days. This probably is the most important part, that you can really decrease the anxiety and the frustration and increase the efficiency of the entire process. You will have the results while patient is waiting. The clinician can discuss the results and provide what are the options for these couple for the next step. In terms of the take-home message here for my talk here, the most important part is that the new artificial intelligence optical microscopic device has a very high level of precision and agreement compared to manual semen analysis, even if it is conducted by a highly trained andrologist. The positive predictive value for X1 Pro is 100% for oligozoospermic samples and about 86% for asthenozoospermic sample, and that is very, very good. The results of X1 Pro correlate highly with the traditional CASA system such as Hamilton Thorne, and which has been a market leader in the for a large number of time. So I believe that X1 Pro is a fast and simple device to operate that offers reliable and reproducible results. And this has been our experience. We have conducted a large clinical trial following our pilot study on more than 106 patients, and the results are being prepared for publication at this time. So thank you very much for listening to me. And this is our group at Cleveland Clinic in Andrology Center. And this is one of the images of the Cleveland Clinic. And you can connect with our program. We are posting daily our research activities, large number of research articles. You have free access to all these publications that we are offering. We are also sharing our latest research presented at ASRM, which is American Society for Reproductive Medicine, European Society for Human Reproduction, American Urological Association. Also, you can learn about our research opportunities and ART training, which are online ART training and opportunities to collaborate. You just have to find me on LinkedIn, Ashok Agarwal Cleveland Clinic, and you can send a request to join.